The progressives hit Joe Manchin after telling colleagues to hit pause on President Biden's $3.5 trillion plan. The Democrats didn't really like being told what to do here, and Joe Manchin seems to be in hot water right now. Let's see here. The remarks by Joe Manchin, who has expressed concerns about the dollar amount in the past, drew ire from the progressives who support the coming spending package, which Democratic leaders say will unlock funding for a number of party-backed priorities, including healthcare expansions, climate change efforts, and immigration reform. Pause on finally delivering childcare, paid leave, education, healthcare, affordable housing, climate action, and dental, vision, and hearing to millions of families across America. Absolutely not. This is what Representative Pramila Jayapal, leader of the Congressional Progressive Caucus, tweeted shortly after reports of Joe Manchin's comments emerged on Thursday afternoon. This tweet by Pramila Jayapal shows us the other side of the coin. While Joe Manchin cites financial reasons and his worry for inflation, Pramila Jayapal points out human reasons for the stimulus bill. After all, some of the Democrats are actually calling this the human infrastructure bill. Remember Bernie Sanders? Right. So can we wait any longer for this? According to the progressives, the wait is over and the opportunity to actually get this done is now. Representative Jamal Bowman also shared photos of homes in his district that were hit this week, asking the senator, how much destruction do we need to see before it's worth investing in our climate? Instead of writing articles, why don't you look in the faces of the residents who have had their basements flooded with sewage multiple times and their power out for days? We deserve better. This tweet came from Rashida Tlaib. Now, with the recent damage caused by the hurricanes, some progressives highlighted the need for a better response to these calamities. The stimulus bill covers this, and the Democrats want to address climate change urgently. Maybe Joe Manchin needs more immersion in matters like these. I guess that's what the progressives are thinking right now, and they're definitely frustrated at him. But what do you guys think about this? We've seen both sides of the coin here. Now, will this affect the upcoming negotiations in the coming weeks? It definitely will, so I hope things go well. A lot is at stake here, and we need the stimulus checks sooner rather than later. Drop a comment down below. Let's discuss this one. So you got Representative Pramila Jayapal. She said, pause on finally delivering childcare, paid leave, education, healthcare, affordable housing, climate action, and dental, vision, and hearing to millions of American families across America. Basically, she's not having it. She put hashtag poverty is a policy choice. But let's make that go viral, guys. Representative Alexandria Ocasio-Cortez, AOC, she also set out her own set of anti-Manchin tweets. Manchin has weekly huddles with Exxon and is one of the many senators who gives lobbyists their pen to write so-called bipartisan fossil fuel bills. It's people, our people, at least 12 last night, sick of this bipartisan corruption that masquerades as clear-eyed moderation. AOC points out the same thing that we did about Manchin's connections to big businesses like Fox News, parent company PAC, donating money to Manchin's re-election campaign. Now, for everybody's context, the Fox Corporation Political Action Committee is funded in part by conservation media mogul Rupert Murdoch. Interestingly enough, though, Murdoch also owns the Wall Street Journal, where Manchin aimed his grievances against the $3.5 trillion stimulus bill. Now, in the second quarter, Manchin also received contributions from many other big corporations, including Pfizer, T-Mobile, Nucor, Honeywell, and Herbalife. It's always a good idea to follow the money, guys. Now, another thing that progressives pointed out is the reality of warm ocean temperatures and increasing sea level rise. Representative Jamal Bowman stressed the point by sharing photos of homes in the district that were hit this week. Straight from Jamal Bowman's Twitter account, he says, "Hey Joe, these are the homes in my district after last night's storm. How much destruction do we need before it's worth investing in our climate?" We talked more about this in our previous video update, which is available through our channel playlist section. You can always check that out right after this one. Just look for that fourth stimulus check update playlist. Should be right there at the top. The August jobs report is in, guys, and we're seeing it as a potential way to get more stimulus money out.
Delta drag. You could see huge job growth in the summer, and then in August, job growth slowed dramatically. Look at what the numbers look like. When you look in the numbers, you can see that 235,000 jobs were added back. That is a big miss. The consensus, John, was for more than 700,000. Even the whisper numbers of a disappointment were 400 or 500,000. So this is a disappointment, and it shows, and childcare concerns are still holding back hiring here. Let's look at how many jobs have been added back since the beginning of the year. You can see this is the weakest since January, and a big slowdown from the summer. We had June and July, big hiring there in June and July, and then the brakes went on there overall here. How does this make us look for? You can see that we are at another 235. And that doesn't add very much. You are still down more than 5 million jobs since began. The jobless rate here, 5.2%. So that is the lowest. So that means there are people still being added into the labor market, right? You are still seeing some hiring. 5.2% is the number we want to see, but we haven't seen the job growth from the company side that we'd want to. Look, this is a really important moment here in the labor market. We have kids going back to school. In these numbers, we saw hiring in education. So we know kids are going back to school. Maybe that will help some of the childcare problems that have held back hiring overall. But the Delta variant is the number one concern here right now. How can you grow hiring when you have people who are afraid to go to work? You have companies who are afraid to keep adding onto their payroll because they're not exactly sure what the fall is going to bring, guys.
Really bearing the brunt here are sectors hit hardest and crucial to the comeback from its economic blow. The leisure and hospitality sector did not add any net new jobs in August, as a 42,000 job decline in restaurants and bars wiped out a $36,000 job gain in arts and entertainment. Employment in retail, another hard hit sector, also fell by 29,000 jobs. Now, this is thanks to the steep losses at grocery stores and building material, as well as garden supply stores. One economist said, "Today's report has the Delta variant written all over it. It is clear that the recent surge in the cases is a strong headwind to the labor market." Now, according to new SSA Commissioner Kololo Kajazi, and its economic impact have had an effect on Social Security's trust funds, and the future course is still uncertain. Yet, Social Security will continue to play a vital role in the lives of 65 million beneficiaries and 176 million workers and their families during 2021. Now, earlier than that, the Trust Fund for Medicare Part A, which covers hospital care, is estimated to have its reserves depleted in 2026. Treasury Secretary Janet Yellen stepped in to reassure everyone that the Biden-Harris administration is committed to safeguarding these programs and ensuring that they continue to deliver economic security and healthcare to older Americans. Now, do you guys believe that? Drop me a quick comment below. So far, we have some very solid Congress proposals on the table right now. First and foremost, really are President Biden's campaign promises for Social Security. Remember those? He said that he wants to increase Social Security payroll taxes for those who are making $400,000 and up. Now, with that, we would be able to fund our Social Security programs and be able to pay for the proposed benefit increases, including a raise to the minimum Social Security benefit of at least 125% of the federal poverty level. Now, that's about $1,341 monthly for you guys. So, that's an increase of $547 a month. Now, I think we can count that as the long-awaited $200 monthly SSI increase plus interest. Now, aside from this base increase, his campaign platform includes the following proposals that could modestly increase benefits for some recipients. Using the Consumer Price Index for the elderly, the CPIE, to calculate Social Security cost of living adjustments, the COLAs, to better reflect the rising expenses that seniors face. A minimum benefit of 125% of the federal poverty level for people who worked 30 years. Gradually increasing benefits by 5% for those who have received Social Security for 20 years or more, allowing surviving spouses to keep a greater share of the benefits of about 20% or more. Our lawmakers are holding President Biden to his word in asking for all of this now. A bicameral group of dozens of lawmakers led by Representative Jamal Bowman, Senator Bernie Sanders, and other prominent progressives sent a letter urging President Biden to include desperately needed improvements to the Social Security Income Program, also known as SSI program, in his forthcoming American Families Plan. Now, according to their letter, it says, "We ask that you devote particular attention to the lowest income disabled and older Americans who are too frequently left behind." Amen to that. Now, what they want to do first is to raise the monthly benefit to above the federal poverty level. Now, as they pointed out, the SSI benefits currently stand at $794 a month, which is far below the poverty line. That's why they're asking for President Biden to increase federal SSI benefits to at least 100% of the federal poverty line. For one person, that's already $12,880. Divide that by 12 months, that is $1,073.33. That's $279.33 more than what SSI recipients are getting right now. After that, the number just keeps getting bigger with an additional $4,540 per person in the household. Now, they may go the extra mile here and raise the number to reach President Biden's 125% of the federal poverty line, meeting an above $500 increase. We definitely don't want to just stick to the federal poverty line, right? I take the extra $500 a month. I don't know about you guys. Now, on top of that, the bicameral proposal calls for reducing income exclusions that take benefits away from those who are earning a little bit of income and removing penalties for those who are married and receiving shelter, meals, and groceries from family and friends. Overall, higher benefits and smaller deductions are the gist of this proposal. Sounds pretty good to me. People on Social Security really are struggling, as Social Security headlines say, "I can't live on $709 a month." Drop me a comment if you can relate, guys. Millions of Americans are either senior, disabled, or survivors of a deceased worker, rely on Social Security benefits for the majority of their income, but the average benefit is just over $1,500 a month. It doesn't provide enough income to cover basic necessities. One example here is Nancy Reynolds, age 74, of Cape Canaveral, Florida. She works as a cashier at Walmart while struggling to make ends meet on her work income and Social Security benefits of only $709 a month. She said that the government is failing all of us seniors. We have to choose between whether we eat or go to the doctor. Do we eat or buy medicine? The struggle is out there even though I'm working. I'm wondering how long I'm going to have my home. How long am I going to be able to pay for it? Should I buy a tent now and store it? Because if I lose my job, I'll be homeless, because no one wants to hire a 74-year-old. Let me hear your Social Security stories in the comments, guys. Is your story like this one? Let me know your thoughts in the comments below. More recently, we reported on Representative Gwen Moore's Social Security Enhancement and Protection Act that will raise your Social Security to 100% of the federal poverty level, so the same as the bicameral group's proposal on an above $200 increase. Now, on top of that, this bill also wants to build a 5% increase for all beneficiaries once you reach the 20th year of retirement. Now, what I especially like about that one is that it offers a way to plug up that gaping Social Security financial hole that's going to sink us pretty soon. Moore's plan includes phasing out Social Security payroll tax cap, which currently only applies to wages up to $142,800. Now, at the same time, the plan also calls for gradually raising the rate at which both employers and employees pay that tax to 6.5% from the current rate of 6.2% over 6 years. Now, according to Moore's statement, he said, "My proposal would help us ensure that Social Security does what it was intended to do: protect all older Americans from spending their retirement living in deep poverty." President of Social Security Works, Nancy Altman, predicts sometime this summer there is a Social Security plan. Senator Mitt Romney, he proposed a bill called the Trust Act to form bipartisan committees that could come up with solutions to fast-track changes to fix the funds for Social Security, Medicare, and the nation's highways. The bill already has bipartisan support, but there's just the worry that the committees may ultimately decide to cut Social Security benefits. According to Max Rickman, president and CEO of the National Committee to Preserve Social Security and Medicare, says here that the Romney plan is a way to cut benefits and leave very little fingerprints from members of Congress on how that was done. That's pretty scary, huh? One way or another, though, we're definitely going to see some developments here. Generally speaking, that will include either the benefit cuts or tax increases, or a combination of both. Now, another proposal that they could possibly reintroduce is the Social Security 2100 Act, which was led by Representative John Larson. This would pay for the Social Security money and even add on to the benefits through payroll tax increases. There's also the Social Security 2100 Act from Congressman John B. Larson. Now, aside from the 2% of the average benefit for all beneficiaries, this bill would raise the new minimum benefit to 25% above the federal poverty line and would be tied to wage levels to ensure that the minimum benefit does not ever fall behind again. Oh, and don't forget the proposal from Senate Majority Leader Chuck Schumer, Senator Ron Wyden, and Senator Elizabeth Warren to increase benefits by $200 per month for all Social Security beneficiaries. Then we have the $3.5 trillion stimulus package that's gunning for Medicare expansion and reduced drug prices.
It is outrageous that millions of seniors have trouble eating because they can't afford dentures.
You know, when you've got just Social Security, it only goes so far, so you got to be pretty economical. It's exactly what it is picking priorities, and sometimes your teeth can't be your first one.
Medicare was expanded to include dental coverage, eyeglasses, hearing aids, and that would really improve people's quality of life and financial stability.
I got 2 teeth missing I'd like to have. And I couldn't afford to keep them because I didn't have the $1,500, $1,600 to have them capped or a replacement for them, as far as that goes. And I got real heart troubles, which the teeth, if they're infected, it gives you a chance to get that infection in your bloodstream and be a little quicker. And I just think it's part of your health. And I think it needs to be addressed along with your hearing and your eyesight.
The one thing that is often lacking in insurance is prevention, that a relatively small amount of money for something like dental cleanings on a regular basis would be able to prevent people from needing $3,000, $4,000, $5,000 dentures.
There is growing support to at least right now expand Medicare to cover dental, to cover hearing, to cover eyeglasses.
People with the glasses they got 10 or 15 or 20 years ago, it's frequently not safe for them or other people on the road, but they're doing what they have to do because they have to get to the grocery store, the doctor. People need to be able to hear, to be able to interact, to be able to maybe have a job and have some extra income. All of those things are really dependent on those services, on those things being provided.
Health care for all and in all phases of health care. They'll tell you it's time to get a colonoscopy to protect your health, but we're not going to have you go to the dentist and get that rotten tooth that's getting an infection into your bloodstream, or let you go around deaf or blind. It just doesn't make sense.
But let's also not forget Senator Bernie Sanders' comparison of insulin prices around the world. Canada, a country right next door to ours, charges $12 a vial, while Big Pharma spikes that price sky high to $98 for the United States. A quick Google search showed that the patients with type 1 diabetes typically require 2 to 3 vials of insulin per month, but patients who are more resistant to insulin, such as those with type 2 diabetes, may require 6 or more. Doing the math here, people with diabetes could save anywhere between $172 and $516 a month if the proposed drug price reduction happens with the $3.5 trillion stimulus package. Now, savings equals more money in our pockets. And what do we say here on our channel, guys? Hashtag poverty is a policy choice. And that's right. And definitely so is more stimulus. Am I right, guys? And that's just one of the drugs that we can get a much needed discount on with this new form of stimulus. But let's see how this turns out when they release the final details soon. Is anyone in the audience on maintenance medication like this? Drop me a comment down below. How much of our tax dollars went to the Afghanistan war? The answer? A lot. In the 20 years since September 11, 2001, the United States has spent more than $2 trillion on the war in Afghanistan. That's $300 million per day, every day for 2 decades. Or $50,000 for each of Afghanistan's 40 million people. In baser terms, Uncle Sam spent more keeping the Taliban at bay than the net worths of Jeff Bezos, Elon Musk, Bill Gates, and the 30 richest billionaires in America combined. And it just keeps going, guys. Since the United States borrowed money to fund this war, estimates show that by 2050, the cost of the interest alone on the Afghan war could reach $6.5 trillion. That amounts to $20,000 for each and every US citizen. Basically, it's us, our children, and even our children's children who are going to be paying for this war well into the future. And that's not even counting the cost of lost lives, which definitely can't even be put into numbers. And so that's why a group of 50 House Democrats wrote a March letter urging President Biden to significantly slash the more than $700 billion Pentagon budget. Their letter said, while we are heartened that your administration is not contemplating expanding the Pentagon's already inflated budget, our new Democratic majorities in Congress, along with your administration, should go further. Rather than requesting a flat Pentagon budget, we urge you to seek a significantly reduced Pentagon top line. But they're going to have a hard time as at least 47 members of Congress and their spouses hold between $2 million and $6.7 million worth of stock in companies that are among the 100 defense contractors, meaning these 47 Congress members benefited from the stock of the top 5 defense companies rising in value by an average of nearly 900% since the U.S. military actions in Afghanistan were authorized in September 2001. Now, we talked about that more in our previous video, so if you want, you can check those out. Or you can just head over to the playlist section, you can find it more easily. We've already grouped all your favorite stimulus: Social Security, student loan forgiveness, and of course the 4th stimulus check. They're all there. Now, speaking of, there's also some hot 4th stimulus check and recurring stimulus check proposals on Congress's table right now. We do have Representative Ilhan Omar's proposal for a federal guaranteed basic income program. Again, that's a nationwide program that they're going to give up to $1,200 per month for adults and $600 for kids. Now, of course, there's also the Automatic Boost to Communities Act from Representative Rashida Tlaib, and that would give out straight $2,000 4th stimulus checks and follow up with $1,000 monthly stimulus checks for each month until 1 year after. Then there's the sweeping House resolution to end poverty from Representatives Pramila Jayapal and Barbara Lee. This includes stimulus checks via cash assistance programs, in addition to a minimum wage increase, expanded unemployment insurance, canceling of all unpayable debt, affordable and public housing, and free education. So really, guys, all we need is just at least one of these stimulus proposals to actually push through. Ideally, in this $3.5 trillion stimulus package that they're working on, we would actually be golden. Now, all we have to do is keep an eye on their defense budget and those wealth and corporate tax hikes. But don't miss a single one of the coming updates. Subscribe to the channel and hit that notification bell. Last but not least, we have some news about, and it's honestly very alarming. It's now affecting more children than it did in the past year. According to a report, more than 20% of weekly cases at the end of August were children. Let's look into this here. It says here that children accounted for more than 20% of weekly cases by the end of August, according to a report by the National Academy of Pediatrics and the Children's Hospital Association. Kids made up 22.4% of cases last week, a higher number than the total average of children cases during only at 14.8%. There was also a 9% increase in the cumulative number of child cases between August 12th and August 26th. So the difference is very significant. Now, from an average of 14.8%, we now have 22.4% in the United States that are just kids. These statistics are very alarming, and this is definitely something that we cannot take lightly. But why is this happening? Well, it could be because of this reason. The high number of cases comes as many children return to in-person classes at school, which has created a flood of concern. Children under 12 are not currently eligible. Officials are looking to change that as soon as the Food and Drug Administration, the FDA, is pressured to approve for children under 12. So, is reopening schools really the best move to make right now? I mean, the FDA has not approved for kids yet. Is the risk of acquiring for getting our kids to in-person classes worth it? Many parents think that it's best to stay on the safe side about these sorts of things. Children are one of the most vulnerable group of people in our society, and they can't even get them yet. I'm pretty hopeful that we can have an option for children by the end of the year, but while we're waiting, it's crucial to do everything that we can to keep them safe. Related hospitalizations and deaths among children are not very common, but the American Academy of Pediatrics said more data is needed to study the long-term effects on children. However, the director of the Centers for Control and Prevention, Rochelle Walensky, said new studies being released Friday report that hospitalizations in children were 4 times higher in states with low rates in August. This comes reported by USA Today. Cases, emergency room visits, and hospitalizations are much lower among children and communities with higher rates. Works according to Walensky. Now, whether you're pro or not, we have to do something collectively and try to prevent the spread of. Please keep your children safe. Let them wear a mask whenever they attend in-person classes because this could protect them. Long-term effects are still being studied, and who knows what those long-term effects could be. If kids get it, there could be a significant impact on their developing bodies. That's what they're currently studying right now. But what do you guys think about this? Will your kids be attending in-person classes, or will they stay at home? Let me know your thoughts in the comments below. So anyway, guys, that's all for the news on your 4th stimulus check update, recurring stimulus check update. Senator Joe Manchin's warning to his fellow Democrats, the progressives' reaction to Joe Manchin's warning, and the news about children comprising of more than 20% of weekly cases, according to the report. But what do you think? Let me know what you're thinking in the comments below. Hope you guys appreciated it all today, and if you have not, do like this video, definitely subscribe to the channel, and hit that notification bell. That way you're notified as soon as I release new videos and content, and I'll see you guys on the next video.